Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then we have neovascular glaucoma. The next type is neovascular glaucoma. Okay, in the neovascular glaucoma, actually here this neovascular, as the name says, there is it is associated with neovascularization of iris. Neovascularization is formation of new blood vessels are formed in the iris. So this neovascularization of iris is also called as rubeosis iridis. So this neovascular glaucoma, the main causes of neovascular glaucoma is caused by conditions like diabetic retinopathy, central retinal venous occlusion. It is also caused by Eil's disease and sickle cell retinopathy. The neovascular glaucoma in central retinal venous obstruction is called as 100-day glaucoma because it takes almost 100 days to form. So in all these conditions, there is neovascularization occurs resulting in rubeosis iridis or and then neovascular glaucoma. So treatment of neovascular glaucoma is to do a pan-retinal photocoagulation along with the artificial shunt operation is done. Pan-retinal photocoagulation along with artificial shunt operation is done with neovascular glaucoma.
thank you and thank you for watching.